Good evening, everybody. I am Dr. Komal from Prashanth Hospital IVF Center. Wishing you all a very happy and safe Diwali. So, one of the commonest concern that a woman approaches during this period is she doesn't want her menstrual cycle or menses to happen during this period, so that there is no hindrances in her celebrations. So, I just want to take this occasion to describe about the menstrual cycle and how it can be either preponed or postponed. So, the menstrual cycle in a woman, as you can see in this chart, has 4 phases. One is the menstruation phase, which is the first phase. During this, whatever the endometrial lining which has been built up of the previous cycle sheds, and the inner lining of the endometrium along with the blood comes out of the vagina, which is called as the menses. Okay, following this, there is a period called as a proliferative phase. Now, during this proliferative phase, the follicle, that is the egg, starts growing through the various stages of development. Around 14th day, there is ovulation that takes place, or the egg release that takes place. This phase, the proliferative phase, is fixed more or less for a period of 14 days. Sometimes there can be variation of 12 days or 15 days. Post this, further changes happen in the follicle, and there is the rise in the level of the hormone progesterone. Now, the proliferative phase, the predominant hormone is estrogen, and the proliferate secretory phase, the next phase is the secretory phase, where the predominant hormone is a progesterone. This phase is constant for a period of 14 days. Now, if a woman wants to prepone or either postpone her menses, the secretory phase is the one which needs to be altered. So, suppose if she wants to postpone her menses, she has to prolong the secretory phase, which is done by adding progesterone for a fewer days longer than the normal days. Or if she wants to prepone her menses, we usually give her progesterones a few days earlier and get withdrawal so that the hormones fall, and then she can get her menses. So as long as the progesterones are continued, she will not get her menses. The moment the progesterones falls, there will be withdrawal bleeding. So by this way, one can either prepone or postpone her menses. This can be done occasionally. It is not harmful because most of the drugs which are used for the purpose are very safe. Ideally, the progesterones are started at least 3 to 4 days prior to the previous expected date of menses, and that's how you can try to manage your menstrual cycle. Thank you.